Connecticut. And when I was 11 years old, I had a really bad skiing accident. And at that time, the solution was to put me in a cast for 6 months rather than surgery, which is what I would have had it been probably 10 or 15 years later. Because the ligaments were never actually repaired, as time went on, they weren't securing my knee. And by the time I was 40, I was living with bone on bone in my right knee. My life had changed so dramatically to really not being able to walk more than a city block or two without experiencing excruciating pain and a lot of swelling, and it really was interfering with my life. I came home at about a 45 or 50 degree level with the CPM machine. I used it as 3 times a day as I was instructed to, and here the machine is telling me that I'm getting up to 60 degrees and 70 degrees, but the physical therapist comes and they use a tool to measure your angle, your bending angle, and I'm only at 50 or 60. And then I think I got as high as maybe 70. And the machine, meanwhile, was saying, oh, you're at 80 degrees or 90 degrees or 100 degrees, and I'm not. The physical therapist has put the fear of manipulation and infection into me, and I get on the internet and I just start looking at what's out there. There's got to be something out there besides a CPM machine, which clearly isn't helping me. With the X10 machine, you're sitting up. Your hips cannot move backwards, so that whatever progress you are making, you are actually making that progress. And the interesting thing was, as I used it, and I would go into physical therapy, we would do some bending, and the physical therapist would measure it. And he said to me at one point how impressed he was that whatever the machine was saying I was getting, he was getting with his tool, with his measuring tool. And he said that that's never really happened before. Being athletic, of course, I'm a little bit competitive. So the machine shows you, tells you where you're at each day, and each day I'd want to get a little bit further. It's sort of, it's competition against myself. It's the swimmer in me. Another thing that we adjusted the machine for was some weight training, so that I could actually start putting pressure on the machine and utilize the muscles in and around my knee and my quads and my hamstrings and all of that. And that was really helpful also. I started on the X10. I was barely able to get 79 degrees, okay? But when it gets to 69 degrees, it slows down a lot. And the second that you as a patient feel that you're in pain, it stops. It senses the resistance of your leg. The X10 was really helpful with getting me from the 79 degree angle to about 115 degrees. And that all happened in 3 weeks. Since they took the X10, I have now gotten up to about 120 degrees. I have no pain walking, which is a miracle. I went to a concert a couple weeks ago in the city, and I walked 15 blocks to Grand Central, and I could have skipped there. I was so happy. Not this past Sunday, but the Sunday before, Joe and I went out and played tennis for an hour, and it was really fun. I would not be at this place. I'm only 9.5 weeks out. I would not be here at this place without the X10. When I tell people who have had knee replacement that I had knee replacement 9.5 weeks ago or 8.5 weeks ago or whatever, they just look at me like they can't even believe it. It really is it's a great invention. I think that there's a lot of added expense and pain that would be circumvented by lots of patients if more people had access to it.
X10, back to full strength.